Welcome back to our Unclenched podcast. Today we're going to talk about CSI of TMJ. This is the fun part. We like being like little investigators to figure out the body. Priya and I always get questions. Can this be related to TMJ or TMD? And many times the answer is yes, it can be related to TMJ. But before we get started, y'all know I got to get caught up with my Priya. What is up with you, Priya? What's happening? And tell me about a patient that you've had so we can get a good feeling, because I know you made him better.
Yes. Well, I haven't made her better yet, but I saw her for the first time yesterday. But before I get into that, I'm doing great. The kids are on summer break now, and I know this video is probably going to come out way after summer break, but I am not smart enough to figure out what I'll be doing at the time that this video comes out. So I'm just going to say what's going on right now. They're so excited about all these summer camps they're signed up for. They're going to do a horseback riding camp or a wall climbing. My daughter loves to climb.
Nice.
She will climb anything. Swimming, tennis. I mean, they're busy this summer, and we're taking them to Yellowstone too. So I'm super excited.
Oh, that'll be fun.
I know, I can't wait. But yes, this patient yesterday came in. Very interesting. She had been having headaches, neck pain, and shoulder pain, and a little bit of clicking and popping for like years and years and years. I mean, that was her like adult life, and she just lived with it. And when I started asking her the question, the headaches could get to like an 8 out of 10 in pain. Like, I mean, they were
Wow.
significant. they,
Sure.
they were significant headaches, right? And so I was surprised that she had never sought treatment before, but she had just normalized it. Like it was her normal. She was a headache person, and she just lived with it. And then her dentist noticed she was clenching, grinding a lot, and they made her a night guard. And she started wearing the night guard, like every single night. And then suddenly the clicking and popping on her left side became a lot more severe, like to the point where it's
Okay.
really unstable. Like it hurts her a lot to open, it clicks loudly. I mean, she's like very close to locking closed, right? That's
Right.
what it sounds like. And so she came in yesterday and I did her exam. We checked her posture. We checked her leg length. We checked a lot of different things. And while I was checking everything, she was like, everything is wrong with my left side. She said, my left foot turns in, my left hip is out, my left rib, my left shoulder, everything's on the left, and the left joint is the one that's acting up. And she was like, can this all be related? And I said, yes. I explained like the postural connection to her, and she was just blown away. And I told her, if you start treatment, there's a good chance we could bring your headaches and your neck pain down quite a bit. And she was just like shocked,
What? Yeah.
and so, that's, I feel like that's the perfect lead into this episode of Unclenched, because
Yeah.
we're talking about the CSI of TMJ. So yeah, that's what's going on over here. Tell me a little bit about you, and then about a patient if you have one.
Well, that's funny you said about your daughter likes to climb anything and everything. My daughter, when she was in third grade, she had a little family meeting around our dinner table, my husband, my other daughter, and I. And she's like, okay, I'm calling this meeting because I want to change my name to Monkey. And I'm like, wow, okay. And my husband's like, you're not changing your name, and blah, blah, blah. And I'm like kicking him under the table. And I'm like, well, why do you want to change your name to Monkey? And she said, because I can climb anything, Mom. I can climb any tree. I can climb the monkey bars. I'm so good on them. I want to change to Monkey. And I'm like, just so not trying to laugh. But I said, honey, when you were baptized, we gave you the name Amalia. And that's what I'm going to call you. You want to go to school and you want to tell your friends to call you Monkey. That's on you. Go ahead and do that. So she's like, yeah, maybe I won't. But that's what that reminded me of with
So
your
cute.
daughter.
How old was she when that
She
happened?
was third grade. So like
Oh.
what's that? 9, 8,
My
9?
daughter's just finished second grade.
Yeah. So there you
I'm
go.
gonna tell her that story. She's gonna
Yeah.
laugh so hard. I mean,
But tell her no changing of the names.
Oh my gosh.
Not allowed.
She loves her name, so that's
But,
not even that's
yeah,
funny.
our family, we were kind of, just I'm relaxing. This month is like the calm before the storm.
Yeah.
And, we've got a few things going on in July, and I'm getting my husband together with friends he hasn't seen in like 40 years,
Is that a
and he
surprise
has
for him?
no idea. It's going to be a
Oh,
total surprise.
you're so
So
cute.
it's going to be fun, and that's what I'm planning. But I wanted to talk today about a patient that's coming in actually on Monday, and I've seen him. And he came to me because he was always talking about his ear ringing. And he came from Columbus, so that's about 3 hours away. And I started him, Priya, on DTR. And I thought I was kind of on the fence. Should I do DTR on him? Shouldn't I? He met the indications that we can go ahead and do DTR. So I said, okay, let's start a little conservatively. But it changed his ear ringing, but not enough. Not enough that he was like, it still comes in and goes, not as bad, but can we do a little bit more?
Yeah,
So I did end up tensing him, taking a bite on him, putting him in an orthotic,
yeah.
and now he's like, this is great. It's gone. So he needed more
Wow.
decompression than what the DTR could handle for him. So on Monday, he's
Wow.
coming in and we're rebuilding his bite, doing his full mouth. And I'm so excited for him. He's such a great guy. Everybody in the office loves him. He's just great. So I'm excited for him to get stability with porcelain that won't change, and he just feels really good. So that's what we go for.
Wonderful. Well, that leads right into our first question, and I actually have an
Yeah.
additional question. So let's start with the connection of TMJ and ear ringing or ear pain. Now, ear pain I can typically help a lot with, but ear ringing is a tough one. Like, what is your success rate with that? Because mine is not high.
Mine is it's pretty high.
Wow.
And it is pretty high.
To,
I
to
want to
make the
say
ear
it's
ringing go away or just to decrease it?
oh, a lot of times I have it go away. Ear
Oh,
pain
good.
always, like you said, I
Yeah,
can
ear
always
pain,
get the ear
yeah.
pain. The
But
ear
ringing,
ringing, I'd say maybe like maybe 80-85% of
that's
the ear ringing.
high.
It really it's and I don't know if it's the bite, if it's the muscles. I use the laser to take the inflammation down,
Oh, I'm not
you
using the
know?
laser enough. Okay.
Yeah, get that laser out because that helps with inflammation and what I do is I do the laser along the path of the trigeminal, and
Okay.
then I'll also laser the C-spine, like the spinous processes on the C-spine.
Okay.
So, I try to go as deep as I can. So that's what helps like a whole lot. So,
Is this the
um,
MLS laser?
that's the
Huh.
MLS laser.
Okay, I
Yeah,
haven't tried that for ear ringing.
yeah, yeah. Try
Okay.
it. Try it.
So
Try
is
it.
that what you say works the best, or it's the combo of
Now,
that?
I think it's a combination of everything.
Oh.
So let's talk about that. So,
Yeah.
um, the patients, let's explain the possible link of TMJ. You always hear patients say too, I've gone to an ENT, ear, nose, and throat doctor, and they say my ears are fine.
Yeah, yeah. So we see that a lot. And if you think about it, your TMJ, your temporomandibular joint, your jaw joint is here, and your ear is right next to it. And there's a very thin wall of bone between the two. So, a problem in the joint, a significant problem in the joint, inflammation in and around the joint can definitely affect the ear. And what I see most commonly how it manifests is ear pain and stuffy ears. Those are the two biggest ones I see. And then a
Yeah,
close third is like ear ringing, oh, okay, so ear pain, stuffy ears, and dizziness. Those are the 3 big boys, and then
yeah.
ear ringing, of course, and then hearing loss. I've even seen hearing that's like at the I
Oh,
don't see
yeah.
that as frequently, but, all they're along the nerve pathways and the muscles, everything's, like, connected there, so it
Right.
makes sense that it would affect your ears a lot.
Right. So let's just be more specific. The nerve is the trigeminal nerve, which is involved with the jaw movement, the sensation, like the trigeminal neuralgia. People get that sensation. And it's connected to the ear, specifically the tensor tympani, which is a muscle, and the tensor levae palatine, which is also innervated by the mandibular nerve, which is the path which is a branch of the trigeminal nerve.
Yes. Yes. So what we do is we use the TENS unit. We use the ultra low frequency TENS unit, and we're stimulating the cranial nerves when we use that. The trigeminal nerve, which is cranial nerve 5, the facial nerve, which is cranial nerve 7, and sometimes even see the cranial nerve 11, which is the spinal accessory nerve for the relaxation of the neck and shoulders. And really, with TMD, everything's connected. The neck and the jaw are besties, right?
Right.
Everything is so interconnected there.
Right. So when the nerve is stimulated, we pulsate the muscle, and it's like a little massage to the muscle, and the muscle relaxes. So every muscle has a nerve, a blood vessel, lymph tissue, and they travel together to the muscle or through the muscle. And when that muscle relaxes and lets loose, by using the tens, the blood flow, it's much easier. That muscle's not really tight and it's not impinging on that nerve, giving you nerve sensation. And then the pain will subside. And like I said before, I do use the MLS laser to decrease inflammation.
That is great. And it's interesting. I'm going to go a little off script here and ask you a
Mhm.
question because a lot of my patients that come in for the workup appointment where we gather all the records, we tens, we get a good neuromuscular bite. Um, Most of them, the majority of them love the tens unit. They
I
are
know.
like, "Oh my gosh, that one patient got so much relief from it. She didn't even want to come back for her orthotic." He was like, "No, I'm fine now. Like, I don't think I have TMD." I was like, "The tens made your symptoms go away." And then
Right.
eventually they started creeping back in. She came back, she got her orthotic. It was fine. But like, that's how powerful it can be. But then there's those few where it kicks up their pain and they're like, "I hate that thing. It gave me a
Right.
headache." Can you
Right.
speak to that and how frequently you see
Sure.
that and why that happens? Because I'm sure people want to know.
Sure. So I do see that happen. And there's a couple reasons I think why it happens. One is they're not drinking the water when they're tensing, so they're not flushing the muscles. They're
Yeah,
not getting rid of the lactic acid. So if they fall asleep while they're tensing in my chair, I'm like, go ahead and sleep. But when I wake you up, I'm going to have you chug that water because I want to flush the toxins, the built up lactic acid, just like when you get a massage they tell you drink water all day and what have you. But the other thing I think why it feels worse is because these muscles have been so fatigued and have been so tired and overworked. Now all of a sudden we're getting this blood rush to them, and it just can't react quick enough again to release all the lactic acid. But my patients typically, because I'll get that every now and again, because those are usually high pain patients, but typically they'll say, I don't like that twitching, and I'm like, you got to let it go.
I
And a
know.
lot of
I
times
know.
those are those really A personalities that
I
want to be
know.
controlling everything. And they're like, I'm not going to let this thing twitch me. And I'm
Yeah,
like, well, no, you kind of have to. So just because I'm not taking it off and you got to do it.
I
But
know.
yeah, that's what I think is happening there with the neurostimulation and all the pathways. It's just a lot of stimulation to these muscles that have been so fatigued or overworked.
Yeah. Oh, yeah, I think so too, and that's what I say. I say, we're unwinding these muscles that have been angry for so long, and we
Correct.
never know if it's gonna be relief or it'll
Right.
trigger more pain for the next 24 hours, but I always say
Right.
drink a ton of water.
Right.
Yeah,
But the
and
best thing is too, Priya, is that I say good or bad, if we get a change one way or the other, we know we can help you because we know we can get in there and change it.
oh, I should say
So
that, yeah.
I'm not mad at that. I'm like, okay, great. That to me is a good sign. We can
It's
get
a
in
good
there and we
sign.
can change it up. It always is a good sign. Any kind of change is good. If you get no change at all, then that's when I scratch my head a little bit more.
Me too. Me too. Me
Yeah.
too.
Yeah.
Well, how about this? We both get patients that have like neck issues, neck pain, or like a really limited range of motion in the neck. So I get this question a lot, like, how is my neck pain related to my TMJ?
Right. Or I go to the chiropractor and I can't hold an adjustment. I leave, it might hold for a day or two. What's going on?
Yeah, yeah, and here we go again. Like we talk about this all the time, the jaw and the start of the neck, like the atlas. occipital joint, the atlo-occipital joint, that
Right.
C1 where it connects to the skull. I mean, C1 literally holds our heads on, and there's tons of between those vertebrae, there's tons of nerves and blood vessels that run up into our head and affect
Right.
our jaw and our head pain and et cetera. So, yeah, I
Right.
mean, there's
So
just
if
such.
you Yeah, and
Mhm,
if you because people are like, "How can my jaw be related to my neck?" Like, my jaw is here, my neck's back here. But
mhm.
if you put your fingers, like, at the base of your skull and right in that depression or indentation, and you press on it and you open and close your mouth, you can feel movement back here
Yeah, you
while
can.
your jaw is moving, and the muscles involved in chewing and the jaw motions are closely linked to the muscles of the neck, particularly the cervical spine muscles. So the cervical spine is the neck.
Yes, yes, and when the jaw joint is not functioning correctly, it can cause muscle tension and pain in the jaw, which can radiate then to the neck and the shoulders, and many people tell me that, this pain that they have in the jaw radiates down into the SCM, which is a major muscle of the neck. So again, the connection here is the trigeminal nerve and the spinal accessory nerve, um, which is again what we stimulate, what we try to calm down with the TENS unit that we use.
Right, right. And studies show that 90% of pain comes from muscle. We just have to find out what muscles they are and we've got to relax them. So relaxed muscles is going to help you get no pain.
Another statistic is 70% of people with TMJ problems have neck pain or like a decreased range of motion in their neck also. And so another thing
Yeah.
that patients and a lot of dentists don't think are related is TMJ problems being related to headaches. And I think dentists
Right.
are getting a better awareness of this now than ever before.
There's a lot of times you'll see headache questions on a questionnaire. Even when you go to the medical offices,
Yeah.
you'll see headaches. But do they ever ask you about them? Really not.
No.
And I know whenever I got out of dental school, that was always on the questionnaire, but I never really paid attention to it because I never knew why. Well, okay, they get headaches, they take medication. I always thought it was more to look at what meds they were taking, if they would
Yeah.
interact with anything we had, because I was never taught that headaches could be related. And so when you check the box, it's just like you're checking the box and providers just blew it off because I was one of those providers. I didn't really go into depth into it or, oh, you got headaches. I feel bad. Okay, well, I'm on this med and that med. Okay, next. That's how it was.
And it's because we spent so much time with pharmacology and drug interactions. So it's like that's what we were taught to do is focus on that. We weren't taught to like dig deep into, well, the headaches could be coming from your jaw. We
Right.
weren't taught that. So how are, I'm sure people have the question, how are headaches related to TMJ problems?
Yeah, and that can be a loaded question. I mean, there are a couple of ways. One type of patient I see a lot are patients with
Mm.
deep bites. So physically you see their upper teeth and their lower teeth, and their upper teeth come over and they really are covering the lower teeth. And that lower jaw cannot come forward. The upper jaw is part of your skull and it stays stationary. The lower jaw is what moves. You can move side to side, you can move forward, but that jaw's trapped. So then what happens is that patients that have those deep bites usually have headaches right in the front, frontal headaches, and then they'll have occipital headaches.
Mhm.
But when you open the bite and you let that jaw willy nilly come free forward, then what's happening is that these muscles are just relaxing because when they're back, they're shorter, they're tighter, and they won't let go. So they cause the pain.
The other type of patient I see as a headache patient is one that has a quote unquote bad bite. So when there's missing teeth or a cant where things are slanted in the smile, that leads to condyles that are misaligned, or sometimes after orthodontia, the teeth have settled after orthodontia. They might be hitting on an incline on a tooth where they're not supposed to hit, and that'll aggravate the muscles of the head and the neck and cause them to have headaches. Many people say they didn't have any problems during braces, but as soon as they get the braces off, that's when all the pain started.
Right.
And so the teeth were moving. So there was no um, consistent spot that everything was hitting. So it wasn't enough to aggravate the muscles. But as soon as the braces are taken off and things settle, if it's not the ideal bite or even anywhere close to the ideal bite, it can definitely lead to pain. And so with these bad bites, that's why sometimes Botox doesn't work because the jaw alignment hasn't changed. We're just trying to paralyze the muscles.
Right. That's a really, really good point. How about the patient? Do you get this? Because I get this a lot. The patient that looks in the mirror and they say, like, I look like I've had a stroke.
Yeah, that look
Yeah.
can definitely be TMJ related.
Right. I see that all the time. We sit and we'll take images of their joints, we'll take pictures of their teeth, their faces, and it's amazing what we see. And when patients are in the conference room and they're like forced to look at their face on a
Yeah.
big screen, they're like, "Oh my gosh, one half doesn't even look like the other half."
Yes.
And I'm
Yes,
like,
and it's so interesting how you don't
"Mhm."
notice that unless you have to look at yourself on a bigger screen, but,
Right.
you'll see, like, maybe one eye is a little bit more closed or, like, slanted, or, what I see often is a stronger masseter muscle on one side of the face, where one side just that muscle looks way more worked.
Right, right. And I see maybe a shoulder higher, like you talked about earlier, like
I
they'll be like
always see a
this.
shoulder higher.
Right, or if they have, like, on a collared shirt, the shirt's, like, over on one side because that
Mhm.
shoulder's lower, and I always check the hips and the way people walk, and then the forward head posture too.
Yeah. Yeah, definitely. It's all connected. And if the muscles are not working the same working power, it'll affect you from one side to the other. So if the TMJs, the jaw joints are not working in sync with each other because the bite's off, then the muscle lengths and sizes are different on each side. You can see that difference, and the patient can feel that difference.
Right, and, like, we can go on and on about that, and there's so many things that we are able to link, and
Mhm.
we don't want you to think that everything we see, we think automatically TMJ, but if we look at all of the information we gather, a lot of times it is TMJ.
Yeah, yeah. A lot of times it is, and again, it's not everything. And I
Right,
always, I say sometimes TMD can be a diagnosis of exclusion. If you've gotten every other test under the sun, moon, and stars, and nobody can explain
right,
your symptoms, that's when we start looking at, the whole body, because TMD can be a whole body thing. It can be coming from your hips or your shoulders, your spine.
right, right.
And today we hit ear pain, neck pain, headaches, and the stroke look or facial asymmetry. And there's a lot more that we could explain.
Right, and if you would like to message us with other possible symptoms that can possibly be related to TMJ, we'd love to hear from you.
Yeah, maybe we can do another podcast with other symptoms and the CSI and how they relate.
Well, that surely sounds good to me.
So send us a message and we can help play detective and make the connection.
Okay. Again, we don't want you to think everything is TMJ, but like Priya said, if you've been to most of my patients, and I'm sure a lot of yours, Priya, they've been to so many other doctors and neurologists and ENTs and PTs and chiropractors, and they're finally giving us a chance and to look at it. I always feel like I'm the last resort, but you know what? Better last than never. So,
Mhm.
you need anything from Priya and I, call us, message us, email us, and we'll be glad to answer your questions.